Good morning. My name is Belén López Álvarez, and I am the Help Desk Assistant and also a member of the Networking and Knowledge Management Working Group of the Year-End Transplant Site. On today's webinar, we are going to see how to share and retain knowledge generated by the European reference networks. To define how to share and retain knowledge, we should first start with the definition. What is knowledge? There exist two main types or perspectives of knowledge. The first one is the tacit knowledge, which states that knowledge is something that people possess derived from an intellectual process, knowing by doing. In other words, knowing by experience. The second type is the explicit knowledge. This type of knowledge can be codified, has a specific objective, it's impersonal, context independent, and it is very easy to transfer. The explicit knowledge is the knowledge that we are more used to manage. It is present in documents, in books, in scientific papers, records, files, etc. This knowledge is only 5% of the total knowledge. There exists a lot of tacit knowledge that it is not that visible. This knowledge can be the experience, the competency, the commitment, the thinking, etc. We should also value and consider this type of knowledge when sharing the knowledge and retaining the knowledge within the European reference networks. How can we share knowledge? As you probably know, the European reference networks are virtual networks involving healthcare providers across Europe. The main objective of these networks is to concentrate knowledge and resources. TransplantSight is one of the 24 networks, and it works for improving the knowledge sharings within the pediatric transplantation field. This is one of the main objectives of the European reference networks. But why we should share knowledge? We have different objectives for sharing the knowledge. The first one is to increase the expertise in a specific area, a specific rare disease or complex procedure. The second one is to improve the pediatric transplantation results by sharing experiences among network experts, to ensure best practice in the treatment and care of patients through clinical practice guidelines, to improve research by connecting professionals and researchers from different areas of the transplantation process, also to provide patients and their families with information about their condition, to improve the home care and their adherence to the treatment, and also to improve awareness of this rare disease and complex procedure by recognizing the particular needs of children. How can we share knowledge? To share the knowledge, we should differentiate between the tacit and the explicit. The Year-End TransplantSight tries to share the tacit knowledge by promoting the rotation of students and professionals in different reference centers. This tacit knowledge is shared by the people that has the experience to the student or the people that wants to gain this experience. In the field of explicit knowledge, there are different ways to share this knowledge that we are going to talk now. TransplantSight has different tools for knowledge sharing. Today we are just going to see the most important ones. The first one is the main way to store it and share knowledge, and it is to make available for the receptors. In this case, to the healthcare providers, the families and patients, and also the researchers of the Year-End TransplantSight interested in receiving this knowledge. For that purpose, the Year-End has developed a specific website where all the knowledge generated can be stored, and it is shared among all the stakeholders. Also, the European Commission has developed two IT platforms for knowledge sharing. This one is the ERN collaborative platform that is called ECP, and it is designed to share documentation among ERN members. Within this information, there is only visible for healthcare providers of the network. This tool is designed for the document management, event organization, and to record all the activity of the network. Another way the ERNs have to share knowledge is the clinical patient management system. This is a secure web-based application designed for sharing and discussing clinical cases among experts in Europe. This tool promotes to share the experience of experts and therefore to gain knowledge in a specific area of rare diseases. Within this platform, healthcare providers they can upload cases and ask for advice to other experts of the network that have the specific expertise in that condition. Transplant Child also has other activities that promotes the knowledge sharing. Between them, we find different meetings. Every year we have 2 face-to-face meetings with all the members of the network. In these meetings, we share all the knowledge generated during the year, and we contact with professionals, which promotes also the knowledge sharing and generation. We also have a program of secondees to move junior doctors among the centers in the network. We also organize an annual course on pediatric transplantation where all the European centers are invited to participate in, and where we share the most important knowledge we have from pediatric transplantation. We also create different webinars on different topics that are also available on the website of the ERN Transplant Child, and where different experts share their knowledge with the rest of the network members. The second step is how to retain this knowledge. For that, we should formulate 3 questions. The first one is what knowledge may be lost and we should retain. The second one is what are the consequences of losing that knowledge? And the third one is what can we do? What actions can be taken to retain that knowledge? How the ERN Transplant Child retains knowledge. We have different measures to retain knowledge. The first one is to create different activities aimed at promoting the knowledge generation among the experts, involving all the healthcare providers that belong to the network. The second one is to encourage communication between experts for the exchange of knowledge, especially through the clinical patient management system, sharing cases and sharing expertise among this platform. The third one is to create good quality materials and good quality documentation that is able to capture the network expertise and that is valuable for all the healthcare providers that are interested in the pediatric transplantation field. Also, to make this material always public and accessible to the healthcare professionals, and also to patients and families that should have the access to the specific information for them, and that will improve the care of the patients suffering from this complex condition. The last one is to promote the collaboration between centers to share the transplant experience, not only by the platform, but also face-to-face, by promoting the movement of junior students and to promote the awareness of pediatric transplantation. That's all. Thank you very much for your attention.